Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical radio show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number, 800-859-0957. Again, that number is 800-859-0957. This is your chance to talk directly to the doctor. So stay tuned and we'll be right back. You're listening to News Talk 760 WJR.
So we're on Facebook Live
We're on
now.
Facebook Live.
I'm trying to be careful what to say.
About what?
Just anything.
No, this is going to be really
Why is this week special?
Right, exactly.
Well, we've been getting slaps on the wrist, so I have to behave.
Yeah, we don't want to be censored anymore.
Right.
Well, we already have a caller, by the way, so we can kick off the next segment with that.
Do tell me who it is.
Greg and Shelby.
Oh, how surprising. Okay.
Oh, we do.
Oh my God, we got it back. So don't say anything wrong. Don't be controversial. What? Must buy? It's too funny. Did you know that we got censored for a couple of weeks?
Uh-oh.
Well, I'm glad.
I guess that's a good problem to have. It means you're saying something that's stirring the pot, right?
Well,
not if anyone can hear it.
Not if no one can hear it
anymore.
That's a
true,
problem.
But it makes people even more curious.
I mean, and is
two callers
quoting.
Who's the other caller?
Is quoting FDA release documents stirring the pot?
No, I mean, it should be common knowledge, right? If it's been released.
And it's part of the public domain? Well, apparently that's not okay.
Yeah, but you know what? It's just the same with her stuff. Her stuff gets bleeped out all the time on Facebook because they say there's a copyright infringement of stuff that she wrote. I mean, music that she wrote. It's so ridiculous. Unbelievable.
Well, this is probably not a conversation. Right. We should not be having on the air, but
who's the second caller?
He dropped, actually, so it's just one right now.
Welcome back, all of you listeners, to our live weekly medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question and talk to the doctor directly at 800-859-0957. Dr. Kolender, always good to have you on the show because you're certainly direct and frank and tell us what we need to do in order to not get the disease that eventually might take us out. Tonight, we're going to be talking about medical gaslighting. Do you want to start off by explaining what that is?
Sure. Gaslighting is making somebody feel that their symptoms are generated by a psychiatric illness as opposed to taking them seriously and listening to what they have to say and investigating their complaints. That's the general description of gaslighting, is ignoring symptoms and attributing them to a mental defect.
And is this common among primary care physicians? Is it common among all physicians? I mean, given that we have all of 4 minutes to talk about what we think is wrong with us, I don't see why we as patients should be penalized or thought of as being crazy because we don't fit into a certain paradigm that the fancy doctor decides, what's wrong with you.
Well, I think the way that this is put off onto patients is that their symptoms are prescribed to stress.
Oh,
And that's how it's put. It's not like, oh, I'm going to gaslight you and you're crazy. Go see a psychiatrist. Here's a Zoloft or a Xanax.
yeah, but
It's
they do that. I hate to
they
tell
do
you,
that,
they do.
right?
They write prescriptions and say, okay, they're not looking into what is the diagnosis all about. Or I guess the Mayo Clinic wouldn't exist, and people going to the Mayo Clinic wouldn't exist if everybody could get an answer for what is wrong with them.
But a lot of symptoms are that's how I look at it, is people are being told they have stress, and this is a stress problem. What do you do with that information? And now, I look at that as something that needs to be managed, because stress management is important for prevention.
Well, before we get behind, let's start taking callers. Siobhan?
Yeah, so up first we have Greg and Shelby. Greg, what's your question?
You guys, Mr. Positive, great show, great topic as always. Real quick, 2 points. When you guys bring up it's in your profile, what does that actually mean? And number two, when you go to hospitals and they have hospitals that have special care for possibly cancer or other diseases, are they implying that other hospitals, let's say a Beaumont doesn't have or Ascension doesn't have the ability to take care of you as the specialty hospitals? Or are they networked where they can get the answers from other hospitals if they don't have it? Or is it secretive?
Well, thanks for calling, Greg. I mean, the first topic, and we could have a whole show on that, we have, when we talk about someone's profile, is what are the specific markers that you have that identify your risk? That's what I refer to as the profile. And, what is your CIMT measurements? What are your inflammatory markers? Do you or do you not have insulin resistance? Are you on the spectrum? Blood pressure, genetic markers, sleep health, oral health, all of these and more data points. And these are measurable data points that can be put together to identify your overall vascular health risk. And each of those conditions also are correlated to other various diseases. So that's your profile. And these are data points that we follow over time to measure our progress in reducing your risk. The other question I would attribute to marketing. This is just hospitals marketing their services. Hey, we're on the top 50 of this list or the top 20 of that list. That's just medical marketing. And we all know that you really can't put any weight on anything you hear in the news at all.
All right, Greg, thank you for calling. Siobhan, you have another caller?
Yeah, up next we have James in Ohio. James, what's your question?
Yes, I'm sorry. I called last week, and I was one that had the 78 years old that has a high blood pressure. But I was wondering, I also run 6 miles a day on my bike. I think you suggested a sleep apnea, but that's not affected as far as my heart or anything. I'm just kind of wondering what I should do because my cholesterol is low, my triglycerides are perfect. It's just last January, my blood pressure was fine, 170 over 80. I mean, that one was 180 over 120 for years, but now it went to 160. And then my doctor just simply said, "Well, you're getting old."
Right,
So
right. I remember you.
I'm just wondering-
Wait, James, why don't you need a sleep study?
Well, I do 6 miles a day on my bike,
So?
I sleep perfect. I'm on keto, and I feel fantastic. I have no sleep problems, and I feel fantastic. I've been on keto for 6 months now, and
Okay,
I've
well,
lost my triglycerides.
listeners,
Okay, listen,
I
Dr.
want
Kolender
listeners.
is ready to preach the gospel
This-
of why you all need to have
This
a sleep
is
apnea test.
What you just
And we've got
listened
20
to.
seconds left. Okay.
Sorry, you just listened to Resistance to Care.
Right.
You were told to get a screening test for a problem that you had, but he's got all the reasons why he doesn't need it, because he knows better, because it cannot happen. It couldn't happen to him.
Yeah, let's come back and talk about resistance on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Holy moly.
Okay.
Typical
mean-
example.
Well, I mean, I guess people probably don't realize that you can have a sleep disorder without necessarily feeling active symptoms like exhaustion, correct? I mean, I think a lot of people might misunderstand what lies behind a sleep study and what it's really identifying.
But what kind of answer is that? I sleep well. I mean, that's kind of like a lame
No, I
answer.
agree, but that's what I'm saying is maybe he doesn't believe that he has some sort of symptoms that are presenting, but they could be hidden, you know.
Well,
I mean, the problem with sleep apnea is that you stop breathing. Is that basically what
You-
we're trying to diagnose?
you're not getting oxygen in your
Not getting enough
blood
oxygen.
while you're asleep. And
Right.
so that's basically what sleep apnea is. Right, technically you're not breathing, but the end result is you're not getting oxygen in your blood, and you may not have any perception of it. And I have many patients who have no idea they have a sleep issue,
Mhm,
and they have sleep apnea.
mhm.
And people just don't want to hear it. And I don't blame them, but if you have it and you don't deal with it, that disease is going to kick you in the butt at some point in your lifetime. Like we
Mhm.
keep saying, there's no point in your life where you want to have heart failure and atrial fibrillation and never feel good again because you could have stopped this 10 years ago.
Right.
All over some concept of vanity that I'm not going to sleep with this thing. People are very hung up on sleep, very. And so this guy's going to keep calling, going, it can't be sleep apnea, but all of a sudden I have uncontrolled high blood pressure and my lifestyle is perfect. Because keto. I'm doing keto. I mean, come on. Let's come back to this. We could talk about this kind of the air. Like, he'll never call again, but that's okay. But I mean,
it's like, who's the doctor here? Somebody, if you're, I mean, it's kind of like he's got a doctor. The doctor is writing the prescription because there is a connection, or the doctor feels as though he may have sleep apnea and therefore go and get the sleep test. And then what kind of an answer is that I sleep well? That's not an answer.
right. So, I mean, this guy got gaslit by his doctor. I mean, let's just come back to this. His doctor said, oh, you're old. That's gaslighting. He didn't get told he's crazy, but he got told he's got a problem that can't be fixed instead of addressing the problem.
Well, the doctor did give him a prescription to go for a sleep test.
No, I told him to. The patient didn't go.
Well, the patient never went.
No, the doctor told him he's old. I told him get a sleep study.
My God. If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show here on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, we started the show by saying we're going to talk about medical gaslighting. And we just had a patient who was told to get a sleep study and didn't.
Well, James called, and we just had a field day at your expense, James, on Facebook, and we're going to keep it going. So James calls and tells us that his doctor told him his medical problems are because he's old. That's gaslighting. What are you going to do about it? It's
Right.
like being told you're crazy. What do you do about that?
Mhm.
Oh, you got a mental problem. That's gaslighting. So he got gaslit by being told there's no answer to the problem that he has. And he calls the show and goes right into resistance, which
Mhm.
is he didn't like what I had to say, which is go continue screening for the diseases that we need to screen for because, does he have sleep apnea? I do not know, but uncontrolled high blood pressure is a symptom of sleep apnea. And the other thing is he's on keto. keto is not a healthy long-term diet. It does not generate good lipid results and actually causes vascular damage. So all
I just
of
want to
these
jump in here.
assumptions,
I mean, I understand that keto is not a good diet to be on.
correct. So I just
Okay, so
said,
why? I know, but why are people so amazed by it and so I mean, they're big,
Well, they lose weight quickly on it, I believe, and so that's
right.
probably an incentivizing
yeah.
factor.
While
And
while it's killing your organs,
right. And
it's
who
okay.
doesn't want to be told they can eat bacon all day and it's okay? I mean, I'd love to get that prescription, but I'm not giving it. I'd like to get it too, but that's not a longevity answer. And so here's someone who's doing all the things that some are good, some are bad, and he's going to listen to what he wants to hear and not listen to what he doesn't want to hear. That's the world. This is what we're up against, is people don't want to hear what they need to do.
And what do
Yep.
we
Well,
do
a lot of
about
the
it?
problem too, not to jump in, is that people are misled to think that if there's not some sort of feeling, like physiological feeling of exhaustion or some symptom that's presenting, that you're fine. Like he was saying, oh, I sleep fine, so I can't have a sleep problem. But that's just misinformation, right?
That's just because sleep apnea is not being marketed for what it really is, which is a silent killer and cause of multiple other chronic diseases. And you don't notice it until you basically fall apart from cardiovascular distress. So and respiratory distress. So until why wait till that happens? I want to screen everybody who's 30 and over. However old James is, what's he waiting for? He doesn't like the answer. So wait for your next call, James.
Right. Well, we have another caller right now.
Yeah. So
Siobhan?
let's jump now to David in Windsor. David, what's your question?
Yes, the question for the doctor is, would there be any time that a doctor can spend more than 5 minutes with a patient to go over what the things that that the patient may be having wrong with them, and some of the deficiencies inside that they may be lacking in terms of nutrition? What about many? You've gone over this before, but are there there aren't that many doctors that don't seem to spend time with their patients, going over some of the things that may be ailing them, and what they need to do to get a grip on it.
Well, as you know, David, lifestyle is a foundational treatment for prevention, and nutrition is a huge part of that. There are some studies that really promote the Mediterranean diet, which is basically fish and roasted vegetables, a little bit of citrus. So that's a big, that's something I recommend a lot, but we need to look at how people metabolize food. And I use a lot of lipids to help identify what recommendations to make. And we use genetics to identify food recommendations. For instance, we've talked about this a lot. I get ApoE measurements. So ApoE is a genetic marker that gives us not just a risk of having Alzheimer's, but an idea of how much of your total caloric intake should be made of fat. And this is just what your body wants. And there's no way to know about this based on, how many miles you're running a day, whether you're on keto or not. You've got to check this stuff, whether keto is right for you. So you just don't know unless you check and have these data points. And, as Greg said, this is part of your profile.
Right.
What markers do we need to look at? So, of course, nobody has time for this in 5 minutes. In 5 minutes, you didn't get past, hello, how are you? How's your kids? How's your husband? Whatever. But 5 minutes are up. Time to write your scripts and get out of there.
So basically, when a patient comes in and they have a specific constellation of symptoms that are bothering them that they feel they need to share with the doctor, if the doctor doesn't plug it in to a certain paradigm, then that's basically the doctor's gaslighting you. They're telling you, well, there's nothing wrong with you because it doesn't fit in to a specific paradigm or a specific illness.
Another way of gaslighting these days might be referrals, which
Yes,
is, I don't
well
know.
said.
Well, let me refer you to, you have a stomach problem, here's a GI. You have a, lung problem, here's a pulmonologist. So depending on your symptom complex, you may get 6 referrals out of that visit. You just don't know. And, I remember back, when, before I'll say my functional medicine experiences, if someone came in with a lot of different complaints, I used to either say you're depressed or your thyroid's off. And now I understand that any hormone imbalance can cause all kinds of symptoms that don't make sense, because hormones have, pleiotropic effects, which means one thing can affect many other areas in your body. And this is a concept that is not recognized by the FDA. They want one drug to fix one thing and have one result. And the understanding that one drug or one system can have an impact on every organ system is lost. And they may know it or not, but it really limits our ability to use more holistic approaches, because that's how to identify one thing that affects everything. And hormones are one of those areas, and why balancing all your hormones is important in staying healthy. And guess what? People get better when you address that, but that's not part of the traditional model. They don't recognize managing hormones.
And I think it's really pathetic. And I just want to give a shout out to Dr. Linda Kiley in Palm Beach, who sent the article in that encouraged us to talk about medical gaslighting. But I mean, it's like, stop and think about the number of patients who they're presenting symptoms. And as you said during this last segment, you get sent off to see a psychiatrist because there must be something wrong with you, because they must be imaginary symptoms, or it's an imaginary disease that doesn't exist. I mean, you take a deeper dive because you're a prevention specialist. So you've got all kinds of tricks in your bag about finding out let's get to the bottom of this. But that doesn't happen in mainstream medicine.
No, and I don't want the listeners to take what you just said and say, well, people shouldn't be getting, psychiatric or psychological care. I'm a huge fan of, psychiatric care, psychoanalysis, understanding what drives any single person's subconscious decision making. That's really the route to self-care, is understanding how triggers affect decisions and feelings that you have. So that requires an expert to help you with that. But you still need a medical workup for physical and problems that you're having, and not be ignored.
And a lot of doctors aren't experts anymore. Anyway, right now we're going to have to take a quick break. Again, you are listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. All right.
Okay, back on Facebook.
Yes.
This is segment 4 coming up.
What?
What?
I'm laughing. It's segment 4 coming up.
Is that right? You can
It
skip
is.
the question about
Right.
what segment it is. Yep. Where
I,
the-
No, I know it.
I asked it because we got a lot of show left.
You do? You don't have a lot of show left.
Oh,
You've got
yes,
2
we
segments
do.
left.
Yeah, but we've covered a
We have a
lot
lot
of
to cover,
ground.
though.
Well, we've covered a lot of ground already.
Yeah.
Yeah, it's it's
No, but I think
unfortunate.
it was
It's-
interesting when you were talking
Yeah.
about hormones and hormone therapy, because most doctors aren't even involved in that. That's not even their bailiwick.
Well, let's come back to the article at the next break, because, we need to address that a lot of this gaslighting concept is directed to women.
Yes.
Let's come back to there.
Hysteria
That,
and
right.
hysterectomy.
Let's kind of come back there and say this is predominantly directed at women, because the system just doesn't recognize women's specific issues, which are monumental.
And not that I'm giving not that I'm giving a shout out to a specific cardiologist, but one of our local cardiologists told me a long time ago that most of the calls that he gets of women that go to Beaumont, they're there for nothing. I mean, it's like there's not anything wrong with them. They're just down there complaining about, they think they're having a heart attack, and 90% of them are not having a heart attack.
Well, he still has no idea, because he doesn't know what their profile is.
Right.
So it's just, women are more complicated,
Mm-hmm.
Period. And everything's harder to treat with women because they're juggling more hormones than guys are. It's easy to
Right.
fix guys. And so let's come back to that. I think that's really where we go, is gaslighting is really directed at women.
Mm-hmm.
I mean, because this a gynecologist wrote this.
Well, you thought I wrote it, so
Well, I did, but that's okay. I
um,
didn't read the end where it said best regards, Linda.
whatever. Okay. Anyway, yeah, I mean, but it's still in all. I mean, I just thought it was what interested me about, the topic was that she said this was taught in medical school. She started off with that. The gaslighting was something that originated, you were taught it, at the knee of your professors in medical school.
Well, if you're just going by statistics, common things happen commonly. I mean, that's how I heard it. Not as, if it's hoofbeats, it's horses, not zebras. But if I heard it as common things happen commonly.
Mm-hmm.
And, it's still better to start with, the common things before you go looking into, the weird diagnoses.
Mm-hmm.
It's just a matter of time and odds, because a lot of diseases are rare. You can't go
Yeah, I
looking for the rare
understand, but
thing on day one.
well, not in day one, but at least you could stay. You could stay in the game, and you're the one that finds all the
Yeah.
rare things.
Well, the key is, that it's being addressed and not ignored, and
Right.
not being told, well, you're crazy.
Paul W. Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about two important topics: prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Dr. Kolender, we're coming back to the subject of gaslighting. Why do you feel as though it's more pertinent with women?
Well, women, again, this isn't my feeling. We're kind of going off the article Dr. Kiley was kind enough to send you. Women are thought of, wrongly now as being a little more histrionic, and
Hysterical,
right.
hysteria.
So, and obviously that's just not true. And we were talking during the break that really, women are more complicated patients, and mainly because they have more hormones to juggle and go through periods of hormone shifting, which has significant alterations in how they feel and how their body works in general, on the immune system, and every other facet of their living and their physiology. So it's very easy to get, as a doctor, to be overwhelmed by someone's symptoms. And because the tools that are needed to take care of people, and women specifically during specific times of their lives, are just not available in traditional medicine. They just don't exist.
But then again, you don't dismiss their symptoms. I mean, this is what gaslighting is all about. It's dismissing the symptoms.
Well, when you only have 5 minutes, the answer is, well, let me have you see a specialist. Here's a prescription, or you're crazy.
Boy.
What else can you do in 5 minutes or 6 minutes? It's one of those things. And a lot of times referral is so that the specialist can tell your patient they're crazy, not you. It's not like you're going to get a better answer from the specialist, because this is a specialist who's still operating within the healthcare system that doesn't recognize balancing hormones thyroid thyroid manipulation, and they're going to give them the same answer. Well, you're crazy. Here's some Prozac.
Yeah, well, we should find some time to talk about your work with balancing hormones. But in the meantime, Siobhan, you have a caller.
Yeah, we have Bruce on the line in Ann Arbor. Bruce, what's your question?
He just dropped.
Oh, all right, that was
Oh,
quick.
I guess
don't-
I guess we lost him.
So,
Maybe he'll come back.
in the meantime, so coming back to, you've talked and you've mentioned about balancing hormones. Is this like one of your specialties?
Not as much with women, to be honest, because
How
again,
about with men?
men, I've got a lot of experience in balancing hormones with men and supplementing testosterone. I think the main reason I use testosterone in men is because there's a strong correlation between insulin resistance and low testosterone, and there's data supporting using testosterone to prevent the advent of diabetes in men with insulin resistance. So this is a great example of how hormones and vitamin supplementation can offset insulin resistance. So vitamin D with K2, which is another vitamin, curcumin, which is the active ingredient in turmeric, and cinnamon. All of these things help bolster and help prevent insulin resistance. So it's no surprise that we've learned that vitamin D helps people deal with COVID. So here you have all of these things together: balancing hormones, reducing insulin resistance, supplements that help reduce insulin resistance, and an obvious immune balance that comes out of that. To me, it makes all perfect sense. That all of these together, among other things, help improve your body's internal environment and reduce chronic disease. So, this is not just something anyone has time to deal with, again, with 5 minutes, because most of these treatments aren't prescribed. They're not pharmaceutical, and they're not, especially the hormone balancing is not covered by the FDA. It's not approved by the FDA.
Why not?
Couldn't even tell you why the FDA does. All I can
But
say,
what you're
well,
saying, your patients obviously benefit from it.
my conspiratorial answer is there is not a approved pharmacological agent. So the FDA cannot oversee bioidentical or natural products. So, the products I like to use are all bioidentical, plant-based hormone products. And so they don't have oversight there.
Mhm.
So what do they have oversight of is a device.
Synthetic? Are you talking about synthetic?
Right, synthetic product with a device that's been patented. So recently a new testosterone came out that was covered for the indications that the FDA will allow, but it's in a device. So that's how pharma gets around using generic products, is they create a delivery device that's unique.
Mhm.
And the FDA buys into this nonsense. Oh, now it's covered, but you got to use this product because it's got a patented device, and that's the only product that you can use because they got a patent. The kicker is so many of these tools can be used off-label, as a generic, as a non-oversightable FDA product, and they're not expensive.
Mhm.
That's the shame of it. It's really the shame of it is they're really kowtowing to pharma. And all right, I am going to go to COVID, because on the news now is Moderna is asking for for kids to be, the FDA to approve kids to be vaccinated. Why isn't the FDA saying we should be vaccinating kids for whatever reason they think it should be, even though I'll disagree? Why does it require the pharma? Of course, the pharma company is going to ask the FDA to have their drug approved. Why is that the driving factor? The company with the most financial gain is asking for the coverage. If it's so important, the FDA should just be offering the coverage. The company to gain shouldn't be asking. So if it isn't that important that the FDA doesn't say we're going to offer the coverage, then it isn't important. Don't do it.
Mm-hmm.
Don't do it because Moderna's asking to make more money because of it.
Mm-hmm.
Do it because it's the right thing to do. And that is our system. It's reactive. Drug companies make a product, and the FDA feels obligated to find a way to make it covered. So much so that they'll even make a diagnosis code and allow marketing. You know, the back to testosterone. So back in 2012, 2013, there were a lot of testosterone products that were approved, but they all had some bizarre delivery device because it was a generic product. So in order for the pharma company to get an approved FDA product, they had these bizarre delivery devices. And you know, then you can market. You remember what's your T?
Mm-hmm.
You know, all of a sudden marketing, what's your testosterone? Do you have low T? Treat it. And so everyone's getting testosterone levels and prescribing it. And the reason it went away is because 2 studies came out and said that men on testosterone had worsening plaque. What ended up happening is, you know, the FDA shut down the whole testosterone business. 2 weeks later, again, this is not published, but the studies were retracted as being, the data was misrepresented. But the FDA did not come back and say, well, let's go back because it's good.
Leaves patients out in the cold as usual. In the meantime, we're going to have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subject we're discussing and you'd like to hear or talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
Did you
Okay.
survive that segment, AnnMarie?
Why, what was
That
wrong with
rant?
it?
No, I'm thinking, while I'm talking, I'm thinking, you're thinking, there goes YouTube.
I know, right? Exactly.
No, it was good, but I think we should come because we kind of ditched the women's subject. So I think it would be good
We
to come
did.
back
All
and
right,
talk
let's-
about women and some of the things that women are experiencing that might be due to hormonal imbalances or stuff that's being dismissed for the wrong reason.
I agree. I did get off topic. But let's go back. I mean, we did get there and then I ranted, but you can always interrupt me.
I can't because you're always, I'm going to get a mirror
I got
over there.
I got an eye over there.
Yeah, kind of,
You
sort
can-
of, but when you want to.
You can
You
just
interrupt him whenever you want.
Yeah.
You
Yeah,
know
when
that
I
you
want,
do it.
that's true. I do.
Yeah.
Whenever he starts really getting off the deep end, then I go, wait a minute, I got to just jump in
you
here.
can do that. No one's stopping
That's
you.
true,
And
but I
people
mean-
like it when you jump in.
That's true, but you were sort of on a preaching
No, you
stance.
can. Well, it's just one thing went into another. You can stop at any time.
Okay, I'll keep that in mind.
You know, because we're watching, you know, the CNN's on the screen in front of me, you know, behind
You're
us, and it's
watching,
like,
yeah.
well, it's like Moderna's asking for coverage for kids.
Yeah, I saw that.
It's like, why does that have to happen? That's nonsense. If it's
I mean,
important,
what is the reason? Why? I mean, what's the
well, we
is it
can't.
necessary?
I don't know that we're going to talk about that
Yeah.
right now.
Okay.
I just think that I mean, again, who knows what any social media network here is going to think is okay for me to say and not to say. But I'm just going to
Yeah.
say that the FDA should be in a forward-thinking position, not always reactive. And if it's important for kids to be vaccinated, then they have access to the data, and they should say the data supports kids getting vaccinated.
Why is it important for kids to be vaccinated?
I'm not saying it is, or
But why would it be right now when COVID's
you're
on its way out?
asking my opinion. Well, let's get kicked off Facebook. So you're asking the question. Kids should not get vaccinated by any means. There's only across all age groups, if you do not have a severe chronic illness that leaves you predisposed to, immune issues, it does not make sense to get vaccinated. They're now saying that half of Americans had COVID.
I believe that. I
That
totally believe that.
that means half of Americans have natural immunity,
Right.
and there's plenty of research data supporting that natural immunity is better than vaccinated immunity.
Mm-hmm.
So, so I don't agree with vaccinating children unless you have a child who has a serious illness.
Mm-hmm.
Just like I wouldn't vaccinate anybody who's, say, under 70 unless they have a serious medical problem where they're at risk.
Mm-hmm.
You're over 70 or 80, go get vaccinated, even though I don't know, but go ahead. Why should the company that stands to benefit from an FDA approval be the one asking for the approval? That just doesn't make sense.
Mm-hmm.
Of course they're going to ask for it. Oh, excuse me, I'm going to open up a money printing machine here. Can I put it here? Yeah, sure, go ahead.
What are you coming back to, by the way?
Siobhan's going
Women.
to ask women.
Women. Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, we started talking about an article submitted by Dr. Linda Kiley in Palm Beach on gaslighting, specifically medical gaslighting and how it affects women. Do you feel as though that exists?
Oh, absolutely. And, the problem, and women will know that a lot of this is so systemic that it comes down to even the research, that a lot of times women aren't even included in the studies. And so that we don't even know how a specific drug or treatment or surgery may affect women differently because they're just not part of the study group. And this has just been a long-term pattern where, doctors need to learn to recognize that women present with symptoms in different ways than men. Angina can present differently in women. And
The symptoms of heart attack are different in women.
right. And so it's something that needs to be recognized. And, and we talk about this a lot of times that, women are just as likely to have heart disease as in men, but they don't have fatal heart attacks. They don't get the widowmaker. They get smaller heart attacks. They're more likely to get heart failure, and they're more likely to get dementia. And these are all more microvascular injuries as opposed to injuries that are, affect your, left main or your left coronary artery that'll cause sudden death. So women don't necessarily die from cardiovascular events like men do, but they live longer, but suffer the consequences of, again, microvascular injury, which is hard to find. You've really got to be looking for it. And you're going to ask the question, who else is doing it? Nobody.
Right.
Nobody's doing the blood work that measures microvascular disease.
Okay, what's the excuse for that? When you say nobody is doing it, why not? Because if women get and are suffering from heart failure, which doesn't have a good prognosis, and I guess you can't treat it, you can't stop it, you can't prevent it. Is that true?
No, you
Well,
can.
you can't cure it. If someone's diagnosed with heart failure, does that mean that there is no turning back from that? You have it, you treat it, but you're not getting rid of it.
Correct. Just like any end organ damage, once it's damaged, the damage is there. Now you're playing catch up. That's why
But can it be screened and prevented? Is it something that's preventable?
all of these things are preventable. Again, I'm going to say the profile and identify and in women, it's important to check blood work that measures microvascular injury. So there are specific blood tests I do. There's something called
You do, but what about the rest? I don't mean to
Oh,
interrupt. What about the rest of the
well,
doctors?
they're not doing it. And if they are doing it, the results may not be interpreted in a way that's going to have an impact on preventing the conditions that drive the disease, such as, all right, if I do a blood test and one of them is called galectin-3 and it measures microscopic heart muscle injury and scar tissue on the heart, and another blood test is called NT-proBNP, which goes up when there's pressure changes in the heart. And if there's heart injury and the heart's not beating as effectively as it could be, that test will be up.
So let me just ask you quickly, are these tests blood tests?
Yeah.
So therefore, any doctor could order this blood draw
Right.
and this blood test. So you don't need to be seen by a cardiac specialist in order to get these tests.
Prevention should be under the guise of a primary caregiver.
Right.
You don't need a specialist to practice prevention. So people get college, are you a cardiologist? You don't need to be any specialty to practice prevention. You just have to choose to do it.
Mm-hmm.
You need a cardiologist when you have an irregular heartbeat, and you need a cardiologist when you've got a critical stenosis, because they're the ones that fix those things. But the kicker is you don't need to ever get to critical stenosis anymore. And we'll probably cut down the number of people having an irregular heartbeat that needs a cardiologist by a half or more when you apply all of these preventive measures. James, the caller.
Well, the problem is having someone to interpret it too. I mean, you could make a list of tests to ask a doctor to give you, but if you don't have someone to really interpret it and put the pieces together and explain what's leading to what, then you're kind of still lost.
Well,
even
that's
if you
a
have a test
problem.
result.
Well, right. And again, this comes down to do we blame the player or the game? So we've always been blaming the game, and now we've switched to blame the player. Now we're going to blame the doctors for not leaving the game and making their own game. So we're no longer blaming the system, right, AnnMarie? It's the doctors need to be taken account for not providing the care that's available.
It just seems that if there is a situation or disease such as heart failure, that women are more prone to get. I know that we can't stop the widowmaker. I mean, maybe we can, but that's like, you get it, you die immediately. But with heart failure, it seems like if it is diagnosable, then why would that not be on the spectrum of boxes that your primary care physician checks? When they do a blood draw, let's just cover all the aspects of things that we could find.
Well, the widowmaker is what I want to stop first and foremost. And then I look at these labs that measure microvascular disease as a really deep dive. And, it's
But it's diagnosable.
it is diagnosable, but I look at it as I'm finding this early. I'm not diagnosing somebody with heart failure. I'm diagnosing that the process is in play, and it's another data point to present to the patient that I need to do a little better with treating all your chronic diseases. And you, person sitting in front of me, needs to do better with what you're in control of, because here's a sign that despite our best efforts, we're still seeing some vascular end organ injury, and it's microscopic. So that's how I use the test, not so much as well, look, you have heart failure. It's the process is in play. Let's pull it back. We all have to work harder. It's just more data to convince people to live their life in a more healthy way, because lifestyle at the end of the day is number one. And no, we're not going to say, oh, just eat healthier and exercise more. You need the specific personal recommendations that your profile provides. And you've got to it's never ending work to stay healthy in this toxic environment.
So is it possible that you can prevent heart failure in women?
I don't see why we can't.
Well, obviously, if you are able to do a blood draw and find that somebody has microvascular disease, you're able to turn it around and prevent it.
That's a plan.
Well, It's a plan, but
If
it's
you
not
have
a
someone
fa-
to help you, if you have someone
Right.
to help
Right.
you,
Well,
then you
that's
need
the
to be guided
plan.
through it.
So, but no one's looking at prevention this way, unfortunately.
Okay, well, they need to wake up and find a doctor that does. Well, unfortunately, we're out of time, so I'd like to quickly thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks to my co-host, Siobhan Cronin, out on tour right now, but piping in. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.
Opinions heard in the proceeding